How many special tests should you deliver on a initial evaluation, a follow-up visit, whether you're a new grad or a student physical therapist or established? It's an interesting question. Should you do 1, 10, 5, 20 special tests, whether it's the shoulder, the knee, the ankle, whatever it is? I can tell you there have been a lot of stories on flaring people up. I've worked in professional sports for over a decade and professional athletes, and I can tell you a handful of stories by going the wrong direction, and I don't want that for you. Inside your clinic, you might have a couple post-operative cases. You might have a fresh ankle sprain or a possible MCL or PCL. Your question then becomes, what level or grade of injury is this? And what does that really help you do? It helps you set the plan of care so that way you can give that patient or an athlete a good timeline so they can understand what their healing process is going to be. That's really the main reason why you do a special test. Yes, it helps you identify the source, but then once you're there, what do you do with that information? It helps you outline, oh, I see, this is a grade 1, that's going to take you 8 to 10 weeks, or it's a grade 2, it's going to take you 12 to 16 weeks. That's all it does. And that's, if you understand why we do the special test, to give you a plan, then you only have to do a certain amount of special tests to help you identify what the plan is. So let me simplify this. If you have an athlete or a patient in front of you that is in pain, right? Like they have a shoulder pain and you want to do special tests on them, but you know they're actively in pain, how many should you do? The easy answer is 1. When they're actively in pain, you just need information to help you forecast what the future holds. You don't need to know the exact tendon at the exact millimeter away from the attachment point. That's not the priority. You don't need to have 5 special tests to tell you that. Your goal is to figure out how long is this going to take for them to heal. If you have somebody who is not in pain and you're trying to solve the case on they've had a chronic issue and it keeps happening intermittently, but they're not actively in pain, this is where you get a little more freedom. You honestly don't need to go more than 2 special tests. Why? Because you just need enough information to not flare them up, but also to give them a plan. So if you have a patient who is actively in pain, 1 special test, enough to create the roadmap. And if they're not in pain, all you need to do is put 2 tests together to create the ideal scenario for them. If you are doing 2, 3, or more special tests, it's only because you lack the confidence to figure it out and that you're over testing them because you're not sure. And what you risk there is they're going to be flared up and they're going to walk out of that clinic thinking, I'm actually worse than what I came in. And it's only because you didn't have the approach that you needed to. You didn't feel confident. You over tested them. Yes, you might have the ideal roadmap, but you just flared them up and you ruined their expectations and idea of what physical therapy is. So the risk is not worth the benefit of knowing exactly which tendon. Simplify your world. 1, if they're in active pain. 2, if they are pain-free. And that is going to help you determine how many special tests you should do per visit that you see someone. And if you feel like you're stuck with treating any type of athletes that you see, specifically barbell athletes, maybe you see CrossFitters or you see weightlifters, you see powerlifters, or you want to see those people, and you feel like you don't have that, you have a very, very small skill gap, you have to attend my Management of the Barbell Athlete course. This is where it's going to help you create a nice healthy gap between anybody who touches a barbell, whether it's your first time or your 1000th time. If you're interested in signing up, go ahead and click on any of the links below, and I'm excited to see you inside the course.